you've completely bathed your patient, you have them in that lateral position so that we're able to change their bed at this point, okay? So I'm going to lower the bed rail. Ms. Hoffman, now I'm going to change your linens now that we've got you all cleaned up, okay? So I'm going to leave you in this position, and the first thing I'm going to do is remove the dirty linens. So loosen those. And I've got an assistant. That's why it's always good to get a second nurse. I'm going to go ahead and move that pillow over as well. Roll the dirty linens as close to your patient as possible before you put the clean linens on. I'm going to put my fitted sheet on first. Remember, we're not going to fan it. We're just going to unfold it gently. Are you still doing okay, Ms. Hoffman? Remember, I said if this is a respiratory patient, someone who's having trouble breathing, they may not be able to lie completely flat. So we're going to do this in a hurried fashion and make sure that they're okay. If they weren't, if they are complaining of being severely short of breath, we would stop immediately and raise the head of the bed. Okay, so I'm going to put my turn sheet on next. That's called a turn sheet or a draw sheet. It really is supposed to go from shoulder to knee, but at least cover the main portion of their body. Roll that up inside itself, and it will go under the dirty linens. Okay, before I turn the patient back over, I'm going to put my side roll back up. Okay, Ms. Hoffman, we're going to roll you over this big hump, keeping her covered as we've done the entire bath. Keep coming towards me, Ms. Hoffman. And then we will get the dirty linens out first. So you'll roll those out and dispose of those. If you don't have a hamper, just put them in the floor, away from the patient. You don't have a hamper, so there you go. Christy's rolling those up good, away from herself, making sure she's not contaminating herself or her clothing, because she's working that long 12-hour shift. You can go ahead and remove the pillow. I take the pillowcase off and just put it in the floor. Never touching the bed, obviously. That's right. And now we're going to roll out our new clean linens, making sure they're tight and taut, and we're going to make sure there's no wrinkles left underneath our patient. Any wrinkle can cause the start of breakdown. So try to remove all the wrinkles you can. Okay, good. And roll that in, and if we have a really long turn sheet, we would tuck it into the mattress. Okay. All right, Ms. Hoffman, I'm going to roll you back on your back. We'll center the patient good in the middle of the bed. Okay. And now I would ask my patient if she were able to hold on. I'm trying to unfold this correctly so that we don't fan it. I would ask her to hold the top of the sheet. And this is not folded correctly, so that's not going to be possible really. I don't know who folded these back. Okay, so Ms. Hoffman, could you hold on to this sheet? You do it for me. Hold on to this sheet as I take away your bath blanket and keep you covered. So I would pull this out. Is it stuck on something? Alright, so I'm removing the bath blanket as I'm replacing it with the new clean sheet. Roll that away from you and dispose. Alright, so Christy, something you would not do is come down to the end of the bed if your side rail's down. We're going to try to stay closely, just like I just did. Okay, so now we have replaced the clean sheet. Now we can put a clean, fresh gown on our patient. That is something that your instructor will get on to you about, is if you go to the foot of the bed and leave your side rail down. Okay, so we'll be careful not to do that. So we put the new gown on. Now we're ready to put the new bed linens, or the bed linen that the patient had on because it was not soiled. We're going to reuse it. And we'll just kind of unfold it on the bed. Okay. And we'll go down there in just a moment. That's right. We'll start here and put these two together. We want to make it look nice, like they would at home, right? So we're going to fold that down, make it look real pretty. Let's go ahead and tuck that in and put our side rail up. You still doing okay, Ms. Hoffman? We're going to give you that pillow back in just a moment. Now we'll come back down here and tuck our linens in nicely. So we'll come in and tuck them in. Now we're going to do a pretty mitered corner. My sheet isn't quite long enough. pull it together here, make a triangle fold here, tuck that in really nicely. Well, it didn't work, did it? And it should make a pretty mitered corner. But that one's not working very well. Okay, after we do our mitered corners, I really don't want my sheet hanging out, but this one is. After we do our pretty mitered corners, you can come to the end of the bed. We want to make sure we're giving them plenty of toe room, so we pull it straight up and just fold it over their feet. And that's our toe pleat, what we call the toe pleat, so that we make sure they have plenty of room for their toes. Now we'll put on the pillowcase. We would not tuck that pillow underneath our chin. We can fold this inside out. We would put the tag of the pillow, if it had one, to the inside of this. Grab this here with our pillowcase inside out, and it folds over it like this. Okay? See how that goes on nicely? And then we always put the open end of our pillow away from the door so that we're not inviting microorganisms into the room. All right. Now we've got our patient bathed, cleaned, new linens. We're going to do our exit routine where we lower the patient's bed to the lowest possible position. Can I get you anything else, Miss Hoffman? Do you need anything? Would you like a drink of water? I'm going to make sure her call light's in reach. She wants her head up a little bit, so I'm going to raise her head. And I'm going to make sure before I leave the room, I'm going to discard, I'm going to pick up my mess, put it in the correct hopper or hamper. I'm going to wash my hands before I exit the room, and I'm going to make sure that Miss Hoffman has all of her possessions close to her again. That she has her water close to her, her magazines, her tissues, whatever it was that I moved. If I took off glasses or dentures or hearing aids, I will put those back. Then I'll wash my hands, and I will tell Miss Hoffman, I'll be back to check on you in about 30 minutes, okay? If you need anything, use your call light. And then I'm done.